So Danielle's worked with us on many different projects in the past, and I've had the opportunity to work with you, Danielle. It's so nice to see you again. Danielle, you're a PhD candidate, of course, in clinical psychology at McGill. Broadly, Danielle's research centers on health psychology and patient engagement in research. Her doctoral research focuses on the experience of caring for a loved one with scleroderma, with the ultimate goal of developing resources to decrease the burden that can be associated with caregiving. So Danielle, with that, I'll give you the floor, and thank you so much for being with us.
Thanks very much, Lacey. So I'm going to share my screen. And just bear with me for a second. And it should. Can everyone see my screen, or can anyone? I guess if not,
I can
let me know.
Yeah, you're up.
Okay, great. So thanks very much for the introduction, and good afternoon, everyone. I'm very happy to be here and to have the opportunity to speak about supporting a loved one with scleroderma. Although it wasn't I'm not able to be in the beautiful Niagara Falls today as was planned. I'm in Hamilton, so I'm not that far away. So I'm going to start today by giving just a bit of an overview of what you can expect from this talk. First, I'll provide some information about what an informal caregiver is and what supporting a loved one with scleroderma, what that could look like. Then we'll get into research that's been done, looking at caregivers previously and someone caring for a loved one with scleroderma. And then I'll go right into the research that I've helped conduct through SPIN on this topic, and I think probably people are familiar with SPIN, but if not, it's a Scleroderma Patient-Centered Intervention Network that's run out of Montreal by Dr. Toombs, who's my doctoral supervisor. And then finally, after I present a bit about our research, I'll just present a few practical tools and resources that perhaps you could use if ever interested. So first off, many individuals that have a chronic condition, whether it's common or rare, receive support from a caregiver. They may be a family or a friend. And this role is also described as an informal caregiver due to the role being unpaid. And also this role is something that typically an informal caregiver doesn't have specific and formal training for. So really I'm saying informal simply because it's an unpaid role as opposed to, for example, a nurse or a personal support worker. But very often caregivers are saying there's absolutely nothing informal about the support they provide. In fact, family and friends are ones that spend a lot of the time supporting a loved one. So caregivers can help with a variety of tasks, such as activities of daily living, helping with chores, or managing medications, just to name a few. And perhaps not surprisingly, most research about caregiving has considered supporting someone with a more common disease, such as dementia or cancer. So that's where a lot of the research has been done for caregiving. But given the complexity of rare disorders, those with a rare disorder also often receive support from an informal caregiver. As you'll see here, this caregiving role is one that perhaps people don't always plan to take on, with 50% of caregivers having reported that they felt they had no choice but to take on this role to a loved one with a rare disorder. Now, certainly there can be positive aspects of caregiving, and I think it's important not to ignore these, but I won't be focusing so much on them in the talk today. And that's because caregiving is also often perceived as a really demanding and stressful role. So what we know is that in North America, just 1 in 5 caregivers report that they're coping very well. And this difficulty coping could relate to the burden that accumulates when adapting to a new role and managing a lot of uncertainty. This burden may also have to do with taking on other roles that are unfamiliar to people, but common for caregivers, especially to someone with a rare disease. So this may be taking on the role of a researcher, doing lots of searching, trying to find out about the condition. It may be taking on the role of a care coordinator, connecting with nurses and rheumatologists and the various different health professionals. And it may be being an advocate for your loved one and trying to support them in their diagnosis. So in line with the burden that we would expect is placed on caregivers, 2/3 of Canadian caregivers to a loved one with a rare disease report feeling unsupported by the healthcare system in Canada. So that really suggests that there's an important need for research to improve the experiences of caregivers that are supporting someone. Oops. So now we're going to get into a little bit of the details of what we knew about caregiving to a loved one with scleroderma before I began my PhD. So I've been doing my PhD for about 5 years or so now. So before we did that, we took a look at the research that was out there of supporting a loved one with a rare disorder, specifically scleroderma. And what we found is that there was really not much in this area in terms of research. So what we found is just one previous study, it was a thesis, that considered the experiences of people caring for individuals living with scleroderma. So as I mentioned, it was a PhD thesis. It had been conducted in the States in 2012, and it included 13 caregivers who were interviewed about their experience supporting a loved one with scleroderma. So really, this isn't a lot of research, just there being one study. Nonetheless, it gave us at least a little bit of a starting point. So what this thesis highlighted, there we go, is 3 main sort of themes or points that came out from talking to the 13 scleroderma caregivers. The first point that really came through was about the personal impact of caregiving. The second one was existential concerns that arise. And the third is the uniqueness of the disease. Now, I won't go over this whole table. I'll just highlight a few points here that perhaps will resonate with you. The personal impact included things like the relational strain that can occur when this relationship is changing and someone's being diagnosed with scleroderma. Relatedly, existential concerns such as shifting into a different life role. Perhaps now you're that caregiver, you're the support person, and that's changed from your typical role in the family. And then there's, of course, something I'm sure everyone can relate to, which is the complications and frustration of a diagnosis that a lot of people don't know about and don't have a lot of education about. So this was what we'd found based on that previous study, or that study had found that. So after that thesis was done, of course, there were still questions that remained about the caregiving experience in scleroderma. So the thesis had actually suggested a few future areas that people could focus on when trying to fill some gaps in how to support the caregivers for someone with scleroderma. So they highlighted a few points, being it'd be good to include more people, as there were just 13 caregivers in that study. Gather more numbers data rather than just quotes, so focusing on quantitative data, and recruiting more male caregivers. And this is because often it's a partner that's caring for someone with scleroderma, and that may be a male partner given how many females have scleroderma. So those were a few areas that were recommended for future research. So with that in mind, the objective of my research was really to focus on burden that's placed on caregivers. And then we wanted to develop a list to better understand the challenges that scleroderma caregivers face, as well as the support services that could be developed and could be found to be helpful. So we did this through a focus group as well as a survey. So I'll be taking a look and presenting what some of this looked like. So to really set the stage for this work, we wanted to understand how much burden is placed on caregivers to someone with scleroderma as compared to other chronic medical conditions, because this sort of helps us understand, in the grand scheme of things, what does this look like? Can we look for other ways to help that have been found for other caregivers? Very briefly, we conducted a systematic review, which really means we were looking for studies that had been published about caregiver burden, and then we collected specific information from these studies. So we were looking for studies that were focused on caregivers to individuals with a chronic condition, whether that was rare or common. We were looking for studies that used a specific measure called the Zarit burden interview, and I'll show you a couple questions from that interview in the next slide. And then for comparability, we were looking for healthcare systems that perhaps could be a little more comparable to North America. So here's just an example of a few of the items in this Zarit burden interview measure. So if you look at number 3, for example, do you feel stressed between caring for your relative and trying to meet other responsibilities for your family or work? So perhaps there are people that support someone with scleroderma that can maybe relate to this item and some of the stress where you're being pulled in different directions with various responsibilities. So I know there's lots of numbers on this slide, and I will absolutely show you where to hopefully focus. The one column we're going to look at is this pooled mean. And here you can see these are really average scores of caregivers to people with various conditions. So you'll see the conditions here, ALS, heart failure, spinal cord injury, and then someone that was, these are scleroderma caregivers. This data was from a different study that we did with SPIN. I won't get into that too much now, aside from comparing these results. So what you'll see, good, hopefully you'll see the box here, where with caregivers to someone with scleroderma, the pooled mean, or their score on these burden items, was the highest of all of these caregiver groups. So what that suggests is that the scleroderma caregivers were reporting more burden as compared to caregivers of any other condition that was included in this in the review that we did. So I think that's quite relevant and something that's important to know, because there are other resources available for people caring for other conditions, and this would suggest we need some resources for scleroderma caregivers as well. So really, as I mentioned, what this means is that the caregivers of people living with scleroderma reported the highest levels of perceived burden as compared to these other chronic conditions. Now, there are lots of important considerations with this research. One is that most of the studies that we looked at had pretty small samples. So of course, in an ideal world, it would be great to get larger samples and make sure it's a little more representative of all caregivers. But given these results, one consideration for caregivers to a loved one with scleroderma is that developing resources that aim to decrease the burden that's faced may be helpful. So now going into our second study, which was about focus groups. This was focused on, actually, you know what, I'll just go to my next slide so I don't have to repeat it. Yes, the goal here for the second study was to work from the ground up and have people with lived experience involved in the study, of course, but also helping to develop a survey so that it could be distributed to lots of caregivers supporting a loved one with scleroderma. But to develop a survey, we needed help identifying a list of challenges that are experienced by caregivers, as well as the support services that they would potentially use. So I often say in therapy that people know themselves best, and I think that's the case with research too, where caregivers know you all are experiencing the disease, so you know the greatest challenges and the perhaps best support services. So having you involved in that research process to create a survey is quite helpful for us. So that's really what we aim to do, was conduct some focus groups to then use that work to develop a survey. So we held 3 group discussions where caregivers wrote lists of all of the challenges they faced when helping support their loved one with scleroderma. So we asked everyone to write separate lists of their challenges, and then also write a list of the programs and support services that perhaps could be helpful in a caregiving role. And that could be any support services they want, kind of ignoring feasibility at this stage, just trying to think about if you could wave a magic wand and you could help, you would have a resource that helped you, what would that look like? And we held these focus groups both in the US and at conferences in Canada, back in Montreal, if anyone remembers that one from probably 2015 or so. So these are just the specific questions that we asked. We said to think about the challenges you faced since taking on a caregiving role to somebody close to you with scleroderma, and list those challenges. And similar with the support service items, just list as many support services that would be potentially helpful as a caregiver. So in these 3 group discussions, we had a total of 7 women and 6 men who were caring for a loved one with scleroderma. And you'll see there was a pretty wide age range here, with caregivers as young as 28 involved in the focus groups, all the way up to 76. So during this process, we also developed a scleroderma caregiver advisory committee, which is quite common with SPIN, making sure that we have more voices being heard. So we were able to bring the list back to that scleroderma caregiver advisory committee just to get more input as well. So starting with the challenges, I've listed here just some of the broader categories that came up of the challenges that caregivers face. So these were things like concerns about their own physical health, financial and work-related problems, just to name a few, but you'll see there's lots here, lacking information and resources, again, which may have to do with the uniqueness of the disease, difficulties coping with the caregiver themselves had that difficulty, while also difficulty of the person with scleroderma coping. So the list of challenges that we had developed from the focus groups, that was then sent to the team, the research team, clinicians, and our scleroderma caregiver advisory committee to get feedback to ultimately create these survey items. So after removing and combining a bunch of items, we ended up with 61 unique challenges that came from these focus groups. Now for the support service items, the three groups developed a list of 41 items, so 41 types of supports that maybe would be helpful. And here again, just a few examples to show you what some looked like. We had, for example, people suggesting online educational support tools, one-on-one support from another caregiver, so on and so forth. And similar to the challenges, we removed any duplicates because different groups sometimes said the same answers. And then we brought it back to the team. And with that feedback, we were able to get that list down to 18 unique support service items that maybe would be helpful for us to put in place for caregivers. So overall, this, as I mentioned, the focus groups were to develop a list of challenges and a list of support service items that we could then use for a survey. And I'll go here. And I guess it's just relevant to note that many of the challenges that were brought up were related to how rare the disease is, which is probably unsurprising. So now here, I guess I'll pause here. Here I'll go into the final study, which was our survey, where we had the chance to get a lot more information from more caregivers about the challenges and the support services. So as alluded to, these survey items were developed from the focus groups. So it was really caregivers that were generating these survey items, which I think is kind of cool. And then our hope from the survey was to be able to identify the most important challenges. So we had a whole list of 61 challenges, but it's helpful to know which ones are most prevalent and most important to caregivers. So we can think about that when developing support services. Similarly, as I mentioned, there was 18 support service items that maybe would be helpful. So we wanted to have the caregivers responding to the survey prioritize these. So we know which ones you think would be best, which one would you be most likely to use. So that was really the goal here. This is just a visual representation of the various stages where we had people's input in order to finalize that survey. So I won't reiterate what I said here. I will just note that the challenges, and we gave the survey online, we asked people to rate the challenges as being not important all the way to very important, so we could understand how personally important it was to various people. And then for the support service items, we asked people to rate them from if they were not likely to use the item, the program if it was in place, versus very likely. So we tried to recruit pretty broadly. If you'll remember, the only other caregiver study done previously had just 13 caregivers. So what we had really tried to do was recruit as many informal caregivers as we could. And thankfully we had help from 5 different patient organizations in North America, Europe, and Australia, which is really helpful to get various different perspectives because they may be different depending on where you are. So here you'll see that we ended up with 202 informal caregivers completing the survey. This was great for us. We were really happy to have a pretty big sample. And participants, as you'll see, most were a partner, so helping to support perhaps your husband or wife that has scleroderma. And yes, and there were more males than females, which was also something that it's good to get more males responding because that wasn't the case in some of the previous literature. And the greatest number of respondents were from the US. I won't go too much into other demographics of who completed the survey, but again, we had 202 people, which was a pretty good start. So what we found was that of these 202 caregivers responding to the challenges, caregivers rated providing emotional support to my care recipient on challenging days as being the most important challenge to them. So that meant of that whole list of the 61 challenges, this is the one that was coming up as the most important. Pretty close behind was being unable to help address my care recipient's pain or comfort. So that was seen as a very important challenge. And then behind that was helping my care recipients set reasonable limits on activities that have become difficult due to scleroderma. Again, there were 61 other challenges, but these were or 61 total. These were the 3 that really stood out as quite important to caregivers. And then for the support services, caregivers rated a caregiver newsletter as being the most likely, program or support service that they would be most likely to use. And then there's, the next one was information about scleroderma on an online reputable website, especially for caregivers of newly diagnosed patients. And that may make sense because at that time you may not be so aware of the disorder, the disease and how it works. And it may be a time where you're really looking for some support and some information. And then again, the third one here was information packages. So rather than being online, caregivers noted that the pamphlet format for someone newly diagnosed, caregivers would also appreciate that type of resource. So a few themes from here is that an information-based resource, especially delivered soon after diagnosis, that was coming out as being more likely to be used as compared to, for example, one-on-one therapy or a support group or something like that for caregivers. So there may be many reasons for that, which I'm happy to discuss in the question and answer period or hear people's perspectives, but this is what we found from the survey. So what that survey really told us was that supporting and helping to address the emotional needs of care recipients, including their physical discomfort, is a really important challenge for caregivers. It's a difficulty that's struggled with. Now, despite the challenges, there are support services that some caregivers would be willing to use. And these seem to be, as I mentioned, information-based resources that could be used independently as opposed to with many other people. And in some ways, I think this is relevant to know in the age of COVID too. If an online reputable website would be helpful, that's something pretty feasible that doesn't take away from the public health guidelines and everything that's in place right now. And I won't spend too much time on this, but I will note that, of course, there's limitations with every research study, and this work is certainly no different. I'll note that in study 1, where we were looking at the different rates of burden, we were looking and comparing various different diseases, and different diseases, of course, have different characteristics and different struggles. So that's something to consider, is that we did compare them all despite the different characteristics. Studies 2 and 3, we were recruiting people from scleroderma organizations and online. So through Facebook and social media, and that may not represent everyone who isn't already connected to things like Scleroderma Canada and these other organizations that can be really helpful. So if anything, we may have got a more generalizable sample for those that are already connected to other people with scleroderma, as opposed to those who aren't. So just things to consider when sort of interpreting these findings. And yes, we didn't explore why certain challenges or support services were rated higher than others. So just something to consider there too, is we know how people rated them, but we don't know why. And I just want to end off with sort of switching gears and showing people where resources are already available. What's nice is that someone that was just discussed before I logged on, she made one of these resources, so you know it's reputable. So just for anyone that is interested, There are a few guides that exist online for caregivers, and if you haven't seen them before, they're really good. I don't think, I may have kept on here some of the table of contents, but there's great content in them, and they're just available online. One is with Sclerodermie Quebec, but it is in English, or at least I found it in English. And then the Scleroderma Foundation Michigan chapter, Laura Diaz, has a guide for caregivers, which is great. So they have some tools and they're available online for anyone who may be interested. And yes, okay, I did pull the table of contents. So here are just a couple of sections, and you'll see some of these sections really do overlap with some of the challenges that caregivers brought up. Like trying to prevent some exhaustion and burnout. The emotions was definitely a challenge that we saw in our survey. So I'll stop there and just say thank you very much to the various people that have been involved in this work and the various different supports that SPIN has and McGill has. None of this would be possible without all the participants and the Caregiver Advisory Committee and the various funding sources. So thank you very much, and I'll turn it back over to you, Lacey, to perhaps do some questions.
Thank you, Danielle, so much for that. Can you hear me okay?
Yeah, thank you.
Great. Okay, so we do have a question here from Violet. And can you see that question? You can, yeah? So yeah. She's just asking if it'll be possible to share your slides, and if you are, you can send them to me and I'll be happy to circulate.
Absolutely, yeah, that's no problem. I'll make a note to myself. I'll send them to you after this presentation, and then feel free to answer.
Yeah. Thank you so much. And I'm not sure if we have any other questions, but we're not rushing anything by any means. You know, this is often an area that goes kind of under addressed, and so this is so important. And as we are we're actually here in Ontario, we just got a virtual support group started, and it's focused on caregivers as well. And it's something that we're learning that people that are participating in these support groups haven't considered to invite their caregiver to be a part of that. And so it's just a really interesting you know, just a concept that, you know, people are thinking about support groups are just for the patient or the person affected, but everybody needs that opportunity to share. Patricia has a question. Are there any books you would recommend for resources?
Good question. I guess I would say it depends on what you're looking for with the book. I don't know caregiver books offhand. I can definitely look at that and email that to you, Lacey, or whoever may be most helpful. If interested in, so I am also a psychologist in training, so if interested in books related to mood and supporting a loved one in general, so not necessarily with scleroderma, there's a great book called Mind Over Mood. So that's one I would definitely recommend, but I can take a look into more caregiving specific books and connect with Lacey and see if we can get that out to you.
Thank you. I can circulate that link as well. So our hope is to put together kind of like a resources page or link post-conference next week. And so I can include things like a link to Mind Over Mood and have everyone's slides available. And that'll come when recordings are all available. So we want to kind of get everything from the conference wrapped up all at once so we can offer all those resources together. Is there a resources, look at me, I should have my glasses on, sorry guys. Are there resources I can get for my family to read and help them to care for me with scleroderma?
Yeah, I think that those, so I'll send these links as well. I think the links to the two resources, the Sclerodermie Quebec, I believe is the first one, and the one from the Scleroderma Foundation, I think those would be a great, the Michigan chapter of the Scleroderma Foundation. I think those would be really great starting points. And I can again send those links out because those provide information both for the caregiver as well as information about scleroderma. Yes, and I see this next question. Let me just write this down, the links. So I'll send links to those caregiving resources, which certainly can be shared with family. And
yeah, go ahead.
Yeah, I see this question. It's a good one. We do have these stats. I don't know them offhand. If I did, I would we're very good at writing tests. But we have a paper that publish all of that, so I can share the paper, but I'll also just pull the actual table that says the exact numbers of diffuse and the different types, time since diagnosis. Time since diagnosis, I think I do have on one of these slides. Oh, no, I don't. But I know it was somewhere around 10 years. It was actually quite substantially after the diagnosis, which is perhaps a little bit surprising for me at least. So yes, we do have those, Lori, and I will share that with you to make sure it's very easy to see the demographics of the caregivers.
Thank you, Danielle. So we'll just wait maybe another minute to see if anyone, if there are any further questions. And once again, I just, yeah, you know, it's just such an interesting vantage point, you know, when you're approaching scleroderma. And so I know that the work you do is so valuable, and we appreciate you. And you've been such a great resource for us here at the SSO and with Scleroderma Canada. So thank you for that.
Yeah, I'm very happy to do that. I know when I was starting this work, one of the colleagues said, you know, how can you justify focusing on the caregivers when the patients need so much too? And I'm like, well, it's so intertwined, right? If the caregiver's not, the loved one support system isn't doing well, often the patient's not doing well too. So I think it can be a really intertwined cycle that we can't just ignore one part of that.
No, certainly hand in hand.
Yeah,
absolutely. Okay, well, perhaps we'll wrap it up. I know we're a little ahead of schedule, but I don't want to keep you. But yeah, let's wrap it up. Thank you so much again for your time today and for your expertise. And I hope you enjoy the rest of your day. You're welcome, of course, to stay with us, enjoy the rest of the sessions. But thank you so much.
Thank you very much. I'll follow up with lots of links and everything to you.
Okay, thanks, Danielle. Take care.